Now coming to inguinal hernia. We would have studied this in first year, second year, as well as in final year, but do we really understand what a hernia is? So when I say a hernia, I'm not telling you the definition. Definition is textbook definition, but what we need to understand from a surgical perspective is most hernias, I would say 90% of the hernias are going to be like this. They will have three components. They will have a defect. Defect means a weakness or a gap. This gap can be in the muscle or in the aponeurosis. There will be a sac. Sac means peritoneum, and within the sac there will be some content. So whenever you think of a hernia, please think of it like this, that for there to be a hernia, there should be a hole in the muscle or a hole in the aponeurosis. Behind the aponeurosis is the peritoneum, so the peritoneum should bulge out, that is the sac, and inside the sac there should be some content. The content can be intestine, omentum, and so on and so forth. There are very few hernias in the body where some of these contents are missing. Like in some hernias, there may not be a sac, there may just be a defect. It's possible. Like in epigastric hernia, there is only a defect. Many times there is no sac. They are still called hernias, but as a rule, most hernias will have this definition or these components that we need to know. A gap in the muscle or a defect, peritoneum pouting, that is the sac, and within the sac some intra-abdominal contents. Now, who gets a hernia? What are the theories? This has never been asked, but it was there in 2018 edition of Bailey and in the last December 2022 edition of Bailey. There are some theories as to who gets a hernia. There is one theory which explains why someone gets a congenital inguinal hernia. This is the one I expect them to ask. Why does someone get a congenital inguinal hernia? Now understand, congenital inguinal hernia is a little different. This hernia happens due to patent processus vaginalis. So this hernia is nothing but a hernia arising due to patent processus vaginalis. Now what is patent processus vaginalis? When the testis is descending from the abdomen to the scrotum, when the testis is descending, it moves through the inguinal canal like this. So the testis will enter the deep ring, then it will enter the inguinal canal, superficial ring, then it will go into the scrotum. So this is how the testis descends in a normal person. As it is descending from up to down, it is carrying with itself a fold of peritoneum. So while it is descending, it is carrying with itself a fold of peritoneum. This fold of peritoneum is called processus vaginalis. Before birth or typically at birth, this processus vaginalis gets obliterated. It gets obliterated. If the processus vaginalis doesn't obliterate, if it doesn't obliterate, then there is a natural defect, that is the deep ring. There is a sac, which is this peritoneum or the processus vaginalis, and some intra-abdominal contents can come into the sac. This is a congenital inguinal hernia. So congenital inguinal hernia is due to patent processus vaginalis. Congenital hydrocele also have the same pathogenesis. Now the theory is this patent processus vaginalis, it gets obliterated due to two hormones. One is called calcitonin gene related peptide, CGRP, or calcitonin gene related peptide, and the other is called hepatocyte growth factor. Hepatocyte growth factor and calcitonin gene related peptide. The theory is if these factors or hormones are not produced adequately, if they are deficient, then the processus vaginalis will remain patent. So they are required to get it obliterated and fibrosed. If they are deficient for whatever reason, then it will remain patent. If it remains patent, you can get a congenital inguinal hernia. This is something that is there newly. It was there in the 27th edition also. Of course, for acquired hernias, there are many theories. many explanations. Most of the explanations talk about abdominal wall weakness. So anything that causes a weakness in the abdominal wall causes it to stretch over a period of time, like birth trauma, repeated pregnancies. So repeated pregnancies, obstetric trauma, or age-related weaknesses. That's why hernias are some types of hernias are common in the elderly. Age-related weaknesses. They are going to be responsible for acquired hernias. But these are some theories. Collagen disorders. But collagen disorders are quite rare. They are responsible. These are some of the theories as to why people get hernia. Not everybody gets it, but some people get it, perhaps because of some of these problems. These are acquired hernias. All right. So these are the things you need to know. The risk factors and the theories. These have never been asked yet. I am sure they will come in the next exam or one of the upcoming entrances.